Hi, everyone, and welcome to Celiac Disease and a Gluten-Free Diet. What is celiac disease? For starters, gluten-free diets are often misunderstood. Many people see them as a trend rather than a medical necessity. But for those with celiac disease or gluten intolerance, avoiding gluten is essential to staying healthy. Despite this, there is still confusion about what gluten is, where it's found, and how serious these conditions can be. This project will break down the key differences between celiac disease, an autoimmune disorder, and a gluten intolerance, which can cause a range of uncomfortable symptoms without the same internal damage. It will also explain what a gluten-free diet actually involves, clearing up common myths, like the idea that it means cutting out all carbs. Finally, this presentation will highlight why gluten-related conditions should be taken seriously, especially when it comes to cross-contamination and eating out. By combining research with real-life experience, the goal is to build better understanding and awareness around gluten-free living. Celiac disease is an autoimmune disorder that leads to damage of the small intestine during the digestion of gluten. When gluten is ingested, it triggers an immune response in the body that leads to the attack of the villi in the small intestine. These villi are vital for nutrient absorption, so when they are damaged, it puts someone at risk for malnutrition. Celiac disease can be diagnosed with two blood tests: serology testing and genetic testing. Serology testing requires the patient to be currently consuming gluten to check for elevated levels of antibodies associated with an immune response to the protein. It is recommended that those who have celiac disease follow a strict gluten-free diet to prevent this damage, avoiding direct consumption and cross-contamination of anything containing wheat, barley, and rye. So, what is gluten intolerance? Now, many people who do not have celiac disease still follow a gluten-free diet due to a gluten intolerance, aka non-celiac gluten sensitivity. While celiac disease can only be diagnosed with a blood test, a gluten intolerance can be self-diagnosed or by a healthcare professional. Symptoms associated with gluten intolerance include abdominal pain, fatigue, constipation, diarrhea, anxiety, etc. Those with a gluten intolerance also have a gluten-free diet, but depending on their level of sensitivity, may be able to consume small amounts of gluten with little to no symptoms. Now, the gluten-free diet. What exactly is a gluten-free diet? Gluten is a protein found in wheat, barley, and rye. Some foods that contain gluten are bread, baked goods, crackers, pasta, etc. Some hidden sources include soy sauce, malt vinegar, oats, and specific spice blends like curry powder and bouillon. It is a common misconception that a gluten-free diet avoids the consumption of carbohydrates. Those following a gluten-free diet can still consume rice, potatoes, corn, and oats, as these grains do not contain gluten. Those who have celiac disease or a non-celiac gluten sensitivity are recommended to avoid anything containing the protein. It is important to note that those with celiac disease or a severe gluten intolerance may follow a strict, no cross-contamination gluten-free diet. Cross-contamination is the act of one food coming in contact with another in such a way that they cannot be separated. For example, if there was a plate of eggs and a piece of toast on it, the eggs would be cross-contaminated with gluten because the toast touched the eggs and their proteins are mixed. This is similar to the cross-contamination that can occur during deep frying, during the process of making oats, within a toaster if there was regular bread used and then gluten-free bread toasted, or on commonly used platforms like cutting boards or plates that had gluten on them and then may be used for gluten-free products. This still allows for cross-contamination meaning it is not safe for someone with celiac disease or a severe gluten intolerance. Furthermore, there has been significant amount of research done on the disease itself due to its impact. Some of this research includes the diagnosis of celiac disease on a gluten-free diet. In the diagnosis of celiac disease on a gluten-free diet, a multi-center, prospective, quasi-experimental clinical study, this research explores new ways to diagnose celiac disease in people who already follow a gluten-free diet. Normally, patients must eat gluten for weeks before testing, which can be uncomfortable and unrealistic. Researchers tested a shorter method where participants consumed gluten for these 3 days, and they found that specific immune responses in blood and urine could help identify celiac disease more easily. This shows that a gluten-free diet can make a diagnosis more difficult and highlights the need for better testing methods. This table shows how the blood tests drawn reflect a celiac disease diagnosis for those with the disease, even when consuming less gluten. Specifically, this table, which reflects how the testing levels for those with the disease are clearly in the correct range to diagnose them. In managing bone health and pediatric celiac disease, effects of a gluten-free diet and calcium vitamin D therapy, this specific research focuses on children with celiac disease and how a gluten-free diet affects the bone health. Researchers found that untreated celiac disease can lead to low bone mineral density due to poor nutrient absorption. But after following a gluten-free diet with calcium and vitamin D supplements, some children showed improved in bone health. However, those who did not strictly follow the diet saw less progress. This highlights how essential a strict gluten-free diet is for preventing long-term health complications. This chart from the research shows the growth in body measurements, reflecting that patients grew and gained weight when they were on a gluten-free diet and with these supplements, indicating recovery and improved nutritional status. In a non-human primate model for gluten sensitivity, this study examines gluten sensitivities and rhesus macaques to better understand how gluten affects digestion. This is a specific type of primate. Now, these primates with chronic digestive symptoms were placed on a gluten-free diet for several months. The results showed significant improvement in symptoms like diarrhea, bloating, and rashes. This suggests that gluten can directly cause digestive issues and that a gluten-free diet can be effective in reducing symptoms, supporting its importance for the research in humans for people with gluten intolerances and celiac disease. This graph shows how symptoms improved for these primates on a gluten-free diet, and when gluten is added back, the symptoms worsened. Now, of course, celiac disease is important to me, and here's why. Well, I decided on this topic because my mom and I have had a gluten intolerance and both follow a gluten-free diet. I've found that when I tell people this, many don't know what gluten is or what it is in. Additionally, eating out can be a challenge for my mom as she is extremely sensitive to gluten and can't have cross-contamination. And some restaurants and waiters and waitresses don't understand the intolerance and they also don't take it seriously. So it puts her at risk for cross-contamination and getting sick from gluten. Additionally, I also have a strong passion for food and nutrition, and I spend a lot of my free time baking and cooking gluten-free recipes like pancakes, putting together charcuterie boards, making cakes, baked oats, fudge, and even more. Here are a few of my recipes that I've made in the past. Now, in conclusion, we have Celiac Disease Awareness Month coming up in May. So I believed it was incredibly important to bring up this topic and to share about it. And to understand the difference between celiac disease and gluten intolerance is key to recognizing why a gluten free diet is not just a preference, but a necessity for many people. While the conditions vary in severity, both awareness, accurate information, and in some cases, strict avoidance of gluten and cross contamination. Misconceptions about gluten free diets can lead to people's needs being dismissed or overlooked, especially in social settings like restaurants. By learning what gluten is, where it's found, and how it affects the body, we can create a more informed and respectful environment for those who rely on these diets. Ultimately, greater awareness leads to greater empathy, and something as simple as taking food sensitivities seriously can make a meaningful difference in someone's health and daily life. This is my works cited. Thanks for watching.